Okoa Mama and Mtoto initiative. So these are 3 approaches. So we should run with you within the county up to 2027. Our impact will be looking at improved maternal and child survival in Kenya through the reduction of maternal and child mortalities and even morbidities following accelerated action. So we are here to accelerate the action and proper shared in our presentation. What areas are we going to accelerate MNCH, including nutrition? So ICRHK will be supporting this Okoa Mama and Mtoto initiative.
Initially, we were talking about the young people, but we realized that when it comes to the implementation of activities, we are dealing with the whole community. So we've had a number of activities that have been running, and it was not just Fanikisha Foundation running these activities, but it was a multi-sectoral task force that was running these activities involving the different ministries and departments. Menstrual hygiene has been a key entry for Fanikisha Foundation. And also we've worked with 180 CSPs that have been trained on a package on sensitizing the community on issues of family planning. So our role as Fanikisha Foundation, we have an introduction meeting with Gwama, County Department Leadership that we've already done, meeting with the CEC and the chief officers and the director for health. The activity number 2 was landscape analysis, because we can't talk about the data that we are not sure. So we will have community engagements, and before we go to the communities, we need to have a planning meeting with the facilities that have been identified. And we already have a number of facilities that have been identified, that is Kikoneni Health Center, Lunga Lunga, Sub-County Hospital, we have Diani Health Center and Mtangalawe. And these will be able to amplify the information concerning maternal health and the Kwale County agenda.
Training, availability of commodities, ensure we have quality of care, support supervision, support for HPTs and community security meetings.
Well, to add on that, our registration status for SHA is quite low.
So I want to take you through a couple of slides. 2014, the pediatricians were ahead of the gynecologists. They realized far too many babies were dying. So they strategized every newborn action plan. And then they quickly realized by 2015, hatuwezi beba mtoto bila mama. M-Pesa came in, dealt with Sambweni. M-Pesa has got nothing to do with health, but they plugged in as a collaborative partner. So you said in 2014 you're dealing with the newborn. In 2015, you can't work without the mother. And the mother should not be dead. So ending preventable maternal mortality. So having put the 2 together is when they now formulated awareness. Every woman, every newborn, everywhere, and every time for us. So what Diana presented to you is what I would use to actually say, in Kwale County, this is where they stand. But you can only do this if you know your context. As Kwale County, what is your priority? Put together. But what's important, all stillbirths tell a story, and they should be counted.
Solutions. I want to spend maybe 3 minutes talking about solutions. Solutions journalism, we have talk show hosts. Basically, talk show hosts. For example, I know in Radio Kaya, there's a commitment every month in Radio Kaya there will be a talk show, specifically on maternal health. Every media house nowadays has a social media platform. Okay? So the message is further amplified.